Gambian health authorities are expecting the results of one probable coronavirus case as confirmed cases still remain at 3. Health authorities in South Africa are widening efforts to screen more people suspected of COVID-19. Cashless transactions may be in South Sudan as a way of limiting the spread of the coronavirus. This and more coming on The World Today. Hello, this is iAfrica TV and it is 1705 GMT here in our studios in Banjul. You are watching the World Today News Bulletin iAfrica TV. I am Amadou Kante and now the news in detail. Gambia still maintains 3 positive coronavirus cases with one probable case whose results are yet to be confirmed. Director of Health Promotions and Education at the Ministry of Health and Social Welfare told journalists at a daily briefing on Thursday. Mr. Njai said the probable case is 47-year-old Bangladeshi man who traveled into the country with the second confirmed case index, who passed away on Sunday. The country registers 8 false cases on a 28-year-old female Gambian who entered the country from London, United Kingdom on 15 March and went into self-isolation when she realized some abnormalities on her body. The second case is a Bangladeshi man who entered the country from Senegal and he was confirmed of contracting coronavirus after his death on Sunday, while the third case is a 71-year-old Gambian from France. Mr. Njai said the probable case started developing mild pneumonia-like symptoms and samples were obtained on him and they are now waiting for the results. Let's hear more from Mr. Njai in this insert.
The probable case. A 47-year-old Bangladeshi national, male, travel companion of the disease, Bangladesh national, sample collected and to be tested on the 26th of March. This are recollected, the sample have been recollected again for further analysis because the first sample that was collected, they still need to confirm it by doing another test, and that was also done.
Head of the sample testing lab said when they do the test, they send it to MRC for the result, saying they are currently working with the MRC team and the ministry is working whatever it takes to have equipped facility. He also gave an update on the situation of the probable case who traveled into the country with the Bangladeshi man who passed away on Sunday.
In the testing, you have a platform that is the real-time PCR. So the reason why the patient is a probable case at the moment is because the screening tests have shown that it is positive, but the confirmatory test is saying it's negative.
Last week, Gambia government approved a 500 million emergency fund for coronavirus during a cabinet meeting and closed its borders and airspace and put off the preventive and control mechanism of the virus, which was criticized by the people, calling it a late decision. And from that update on the current situation of the coronavirus in the country, next we head to South Africa, where of course the South African health officials are speeding up efforts to screen more suspected people of the coronavirus or COVID-19 as the number of affected persons of the deadly virus continue to rise in the country. More than 100 people go through the screening process on a daily basis, and positive result cases are confirmed within 6 hours. Let's have more details of that in this report.
The coronavirus case tally is growing daily in South Africa. Most of these recently returned from Europe. Worryingly, local transmissions are growing. South Africa's biggest hospital, Chris Hani Baragwanath, is now screening all patients with severe respiratory conditions for COVID-19.
Individuals that are coming in from the community, that are coming in, as an example, and are hospitalized for a pneumonia, for a severe chest infection. Right? Those individuals are now going to be routinely tested to see if we can actually identify the virus in those individuals.
The onset of flu season brings an increased burden of respiratory illnesses, making the workload tougher for medics.
There are a lot of patients that we need to get through. I'd probably say screening between 70 to 200 patients daily. We test for a large number of viruses and bacteria, but we've adapted our surveillance to be more specific to coronavirus.
So the swabs come in through to our lab, our receiving area. One of our medical technicians then takes control of that sample. They document everything they need to do. They make sure that the sample is in good condition, first of all. Then they transfer it into a tube. Then that would go through to one of our scientists who would then begin to extract the DNA.
We use 3 different assays, COVID-19 N1 through to N3, and our internal control RNP3. So the internal control pretty much just ensures that we have extracted our DNA that we are testing correctly. From here, we pretty much put it into a 96-well plate and we test it on what we call a 7500 PCR or Q quantitative PCR machine.
It takes 6 hours for a COVID-19 test to be completed. If the result is positive, it's sent to the National Institute of Communicable Diseases for further verification. The next few days are crucial for South Africa. The concern now is how fast the coronavirus will spread if it reaches poor and overcrowded communities like Alexandra, where social distancing may be impossible.
And from the report there in South Africa, we will now take a break and come back shortly with the remaining update stories. Stay with us, we'll be right back. Welcome back. You are watching the World Today News Bulletin on Africa TV, and now to the rest of the stories. Next, South Sudan. Now, South Sudan Central Bank is devising means to reduce cash transaction as way of controlling the spread of the novel coronavirus in the country. Travel agencies have also started feeling the impact of COVID-19 as the government suspends flights from affected countries. It will take some time before the new system can be adopted by the citizens. Let's have more of that in this report.
Most transactions in South Sudan are done using cash, but the Central Bank of South Sudan wants to change that. With increasing cases of COVID-19 reported across Africa, it fears that South Sudanese people face the risk of contracting the virus when using cash.
The switch has benefit to all stakeholders or financial institutions. It can be used for cross-border retail payments through mobiles and cards.
However, the change from cash to cashless transactions may still take some time. The Bank of South Sudan says it is consulting with commercial banks on how to roll out the products. South Sudan has suspended flights from Egypt and the United Arab Emirates over what it says are measures to prevent the spread of the coronavirus. Travel agents say the suspension of the flights is costing them money.
We are here because of the airlines. If the airlines are not operating, actually we will not be in a business. So it's our wish that this thing shall have to come to an end as soon as possible. A solution has to be found so that we'll be able to continue. Cancellation of flight means we don't have a business.
The members of the public here are now taking measures to avoid the spread of the coronavirus.
The moment Juba is safe, but we are still afraid. We are using hand sanitizers, and we are also having plans in case of any virus in this country.
South Sudan's new government is just being set up, and the World Health Organization is scaling up operations to help the new unity government fight the spread of the coronavirus. Years of civil war in South Sudan has negatively impacted on health system in the country, with hospitals struggling to manage treatable diseases such as malaria, and the fear here is that importation of coronavirus could pose a serious threat to the entire country.
From that report there in, of course, South Sudan, next we head to Uganda, where a courier agency in Uganda has adopted a new system to deliver goods to customers without any physical contact as a preventive measure against the coronavirus. With the innovative business, of course, in the country, employers and customers are assured of safety and amid of the spread of coronavirus. Let's have more details of that in this report.
Henry Lewega is a courier at an online marketplace, Jumia, Uganda. He's been instructed to keep a 1 meter distance from all customers.
You can put the item on the doorstep, then the customer comes, verifies the item. After verifying, he or she puts the money at the doorstep, and you are supposed to come, pick the money from doorstep, then you step back and the customer steps back.
Using this method, employers hope to keep their staff and customers safe.
We want to minimize the risk of contact, minimize the risk of transmission between us and the customer and vice versa. And so we encourage customers to pay cashless, and we're able to take an item, deliver to your premise without touching you in a safe manner.
Uganda is currently on a partial lockdown because of coronavirus, and for those who want to buy products while at home, this online shop is increasingly becoming an option. The company has also taken other measures to contain the virus, such as regular temperature checks. The Uganda government has issued guidelines on how to stay safe. They include anyone with a flu-like symptom is required to seek treatment, wear a mask, and stay at home. It's hoped that if these measures are complied with, many Ugandans could be saved from contracting the disease.
That report there in Uganda would, of course, certainly bring this news bulletin to an end as the world continues to fight against the novel coronavirus disease, and I hope pretty much soon there will be a way to end its, of course, negative impact on the world. But for more on these stories and others, you can also log on our website on africa.tv. Many thanks for the pleasure of your company. Bye for now.